Hello and welcome to this edition of the eClinicalWorks podcast, broadcasting from the eClinicalWorks National Conference in Orlando, Florida, 2016. eClinicalWorks is often touted as a very flexible system with a lot of customizable activity, capabilities, I should say. And here to speak with me about that this morning is Dr. Manish Shah, MD, internist and pediatrician from Tampa, Florida. Dr. Shah, thanks for being here today.
Oh, no problem. Thank you for having me.
We're talking about customization of the system, and you had a very unique use case for that. You have an office in Tampa, Florida, but you said that you all of a sudden one day had to start worrying about Zika, with a very timely topic. Tell us about that.
Sure. We had a patient that had traveled on a cruise to the Caribbean, and she came back with symptoms consistent with Zika, fever, and joint aches. And she immediately had looked up herself if this is something that could be related to the Zika virus. At that point in time, she said, well, maybe I need to come in and get checked out. At that point in time, she presented to my office, and then we had some interesting conversations, and then led to us wanting to test her for the Zika virus.
So this scenario obviously is one that's just recently started to become an issue in this country. So I have to ask the question, did your lab compendium have the test that you needed to do to figure that out?
Right. So at the time, which was about 2 months ago, none of the labs had completely set up their Zika virus testing. However, LabCorp and Quest had come out with their testing, but it couldn't have been pushed to the compendium right away. So they weren't in the compendium, so we had to go and add them into the system.
And you were able to do that through your EMR labs menu. Tell us about that process.
Correct. So when you go into the labs menu and you go to labs diagnosis and procedures, you can add in testing as long as you have a CPT code. So going into the Quest test center or LabCorp's test menu, you can go in, search Zika virus, find those tests, and then look up their CPT codes and then make a new code or make a new test. Once you've added that test into the menu, then you can go about ordering it, which made it much easier for us because we went ahead and did that, and we were able to communicate what test we wanted to them, which went through successfully.
So you didn't have to wait around for some outside source to push the information to you, which might have taken months. You were able to go in, configure those labs, set up all of the correct lab codes and LOINC codes and associations so that you could broadcast that through your lab interface or get that to the lab company in the correct manner so that they can get you the information back. Correct.
Once you can look up the test code from their website, so typically going to questdiagnostics.com or labcorp.com, looking up their test menus is pretty reasonable. So typing in Zika is not going to give you a bunch of results. So it was pretty straightforward to find their test codes, and then adding them in as long as you had the correct test codes in, made a transfer.
So how did that go? Were you able to perform the test, do the draw, and get the results you were looking for?
Yeah, so I hesitate with this answer, which is unfortunately because there are very specific requirements for the specimens, including refrigerating the specimens for Quest or freezing the specimen for LabCorp, we were not able to get it there correctly. They had some new processes that were required by the CDC, which required that the samples be completely separate from other testing. And when you order Zika testing, you should be also doing some dengue virus antibodies. And unfortunately, if you just send one vial, they can only do the dengue virus testing. So we were not able to get the Zika virus testing as well.
So there are some additional pieces of information that we might not be used to seeing, maybe even some, I think you said there are some specific questions in that case. And eClinicalWorks can allow you to configure those things as well.
Absolutely. So the Ask at Order Entry feature of eClinicalWorks is very helpful there because then you can notify the lab why you're testing the patient, because one of the requirements at that time was that the patient should be pregnant and also that we document what symptoms they had and a travel history, which at that point would give the lab the information that they need to proceed with the testing without having to call you to verify the need for that testing.
Now, the question, of course, will become how do we effectively get that information? And eClinicalWorks obviously provides some tools for that, which we'll discuss in a little bit. But once we've configured those pop-up pieces of information, which of course patient safety I think comes into play there, which is on the top of everybody's mind today. What information do we maybe need to start conveying to patients regarding these scenarios?
I think in general for Zika, anybody that has a travel history to the Caribbean or South America, they should be tested if they're pregnant. For people that are not pregnant, the symptoms could initiate testing. So if you have fever and muscle and joint aches, then those people should be tested. I think the nice thing about eClinicalWorks is that we have a whole bunch of different options that we can use to capture those patients that would actually need testing and would benefit from testing by either using the messenger or something with the kiosk, adding a questionnaire in the kiosk if you're using the kiosk, sending out a message through the messenger, or even portal messages for your patients that it would apply to.
Right, certainly a lot of very important information that we want to maybe broadcast to a large set of our patients. And, if we had to try to do that through the phone or wait for them to come in, that just wouldn't work for us. So obviously eClinicalWorks provides eClinical Messenger, which you can use to call or text your patients with certain messages or information that they should come in. And then there's also publishing messages to the patient portal if you've been getting them on there. Now, the other thing is you mentioned that we want to ask them those specific questions. And I want to mention that the eClinicalWorks patient portal gives you the ability to publish a questionnaire to the portal so that you can send the patients a message saying that this questionnaire is available, we would like you to fill it out. They can log into their portal and answer those specific questions. And of course, that information will flow to your EMR so that you can take action on it, follow-up action. And you mentioned another place where we might capture that information as well.
Yeah, I think the kiosk on check-in would be huge, because if they didn't answer it in the portal, then at least you have the other option of catching them when they're actually in your office. It's always frustrating when the patient's left the office and you're like, oh, I forgot about the flu shot or the pneumonia vaccine. If you have that question already there, the next thing you know is at least it's populating for you. You know that that person has an actionable result that you need to take care of, which is huge, because it takes that little bit of load off of you to take care of all their other problems that you're commonly dealing with.
Right, using that iPad kiosk that eClinicalWorks supports, you can put a questionnaire item in there as well, so that when the patient checks in, we're sure that they're going to answer that item. Great usage of that technology there. Now, of course, we're in Florida. Florida is known for being a place where there's a lot of older patients. Do you, in the care that you deliver, do you find that older patients are less likely to use the patient portal?
Actually, my experience is exactly the opposite. My older patients aren't afraid of the kiosk at all. They're not afraid of using their computers. Most of them are calling me when their results aren't back on the system soon enough. So for the most part, they're actually very computer savvy. There are a few people, and I'd say a very small number of people, that tend to avoid the computer. But for the most part, they're logging on in the portal. They're asking to get their logins reset. So I know they're using them. And our population is at least 20% that's over 65, and our, utilization rate for the portal for those patients is, I would suspect, 75% or higher.
That does certainly sound like some very successful numbers there. So, of course, that leads to the second question, right? The first anxiety that people have is, well, I mean, what's the use of getting patients on the portal, especially those older ones? They might not even use it. You've said that that's not the case, that they're willing to use it. Now, the next question that people have, or the next hesitation that they encounter, is that, well, now am I going to be bombarded with messages? Am my whole day going to be taken up with secure messaging? Does this secure messaging through the portal make your job easier or harder?
Oftentimes it makes it easier. I have my patients, instead of calling the office, use the portal to communicate directly with me. If I need them to call me back with their blood pressure or their blood sugars, they're using the portal to tell me that their blood pressures are actually fine, or their blood sugars are fine, or if they're not, I can make an adjustment on the fly and not have them have to come back for a visit, which, when you've just seen them a couple of days ago and you've told them, hey, look, if the sugars are not better, I need you to do this, at least that documents what you're doing, I think, cleaner. And I think when we're documenting cleaner, at least you know, going back, hey, look, I just did this, and this is what I was going to do, and I've documented now what I'm planning to do.
So flexibility, organization, cleaning up workflows, simplifying things for you and other doctors.
Absolutely, and I think the documentation is even more key, because now you've actually seen what you were thinking all along. Because if you may have had a phone conversation and didn't document it, I think that's a little bit of a guessing game later. What did I tell you to do? Or what are you doing now? I think having it documented makes it so much cleaner, and that messaging function actually makes it that much cleaner, because you're directly communicating with the patient, especially for your complicated patients.
Well, Dr. Shah, thank you so much for sharing your thoughts with us. Thank you for being here at our national conference.
I appreciate you having me.
And we're going to sign off now, but thanks for watching this episode of the eClinicalWorks podcast. You can check out our other episodes on iTunes, YouTube, and my.eclinicalworks.com. For the eClinicalWorks podcast, I'm Adam Salati. Thanks for watching.
This broadcast and its contents are the sole property of eClinicalWorks and are protected by federal law and international treaties. You are strictly prohibited from making a copy of, modification of, or form of rebroadcasting or re-encoding this broadcast without prior written permission from eClinicalWorks Public Relations, except as may be permitted by law. This broadcast is provided for informational purposes only. It is intended as a personal, non-commercial use. Product specifications are subject to change without notice. Please contact eClinicalWorks Public Relations with any questions. eClinicalWorks V10 EHR is ONC HIT 2014 edition certified as a complete EHR. eClinicalWorks V10 CC 2014 955447-1.